The 58th All India Congress of Obstetrics and Gynecology will be inaugurated on 22nd evening at 5:30 p.m. at the Chennai Trade Center. This is the fourth time this conference is coming to Chennai. In 1991, we held the Congress at the Vijaya Shesh Mahal at Kodambakam. Then we had 2,500 delegates. This year, we are expecting nearly 9,000 delegates, along with another 2,000 accompanying persons. So managing a crowd of 11,000 people, along with the trade and the support staff, is quite a Herculean task. And we are happy that we have the lovely location of the Chennai Trade and Convention Center to hold the meeting. We've been working on it for the past 2.5 years with a very good organizing committee composed of the doctors of the Obstetric Gynec Society of Southern India. And this team has carefully put the meeting together. Now, why do we have these meetings? The basic purpose of the meeting is to promote education. Along with that, we have several other advantages, like building a bond of friendship among doctors and the gynecologists, sharing experiences, because very often experience is a very good teacher. And this is what we hope to achieve in the next couple of days. We have talks both on very simple procedures which have been there for many years, and also high-tech procedures which very many people are interested in hearing about. But whatever you hear about, it's the normal delivery and the care of the mother that's going to be of paramount importance. We have speakers both from India and abroad. We have a large group of speakers from the Southeast Asian countries, and they would all share their problems, because many of those problems are similar to what we face in India. This conference would not have been possible without the extensive support from our parent organization, which is the Federation of Obstetrics and Gynecology, with its headquarters in Bombay. This organization has got around 32,000 members and is one of the largest bodies of obstetricians and gynecologists in the world. This meeting goes on for 4 days. It started with workshops. We have had 11 workshops all around Chennai. We had a gynec endoscopic surgery workshop and an ambulatory gynecology workshop at the Sri Ramchandra Medical College at Porur. We had a critical care workshop with about 700 participants at the SRM College at Katankalattur. We had a vaginal surgery workshop at the Kasturba Gandhi Hospital and a cesarean workshop at the Institute of Obstetricians and Gynecologists. There was a fertility workshop which was held at the SRM Hospital at Kodambakam. There were another 4 workshops, 2 on ultrasound, one on fetal medicine and the other on imaging in women. Now, these workshops were hugely popular, and a total of 3,750 doctors spent the time, the whole of a day, at the workshop with practical workshop and live surgeries. It was very popular. Then we had a continuing medical program today, which started for about 5 hours, and here again we had a very large attendance of around 3,200 doctors. Now, why do these doctors come from so far? They come from so far because they know that in the south we are very reliable in our procedures, and they appreciate the hard work done by the gynecologists in the south of the country. Chennai has always been known as a sort of mecca for medical tourism and education, and we hope to continue holding the flag high in such a way that Chennai does much better. One of the big problems which is faced by the obstetricians and gynecologists is the problem of mothers suffering during delivery and the high levels of maternal mortality. Sadly, our state is still below a country like Sri Lanka, which is a role model for less developed countries in the field of maternal mortality. Now this is a big hurdle which we should try and cross. We have good support from the government of Tamil Nadu in trying to decrease the rate of maternal mortality. But in meetings like this, doctors who come from small rural hospitals get to see work done in bigger centers, and some of those ideas they are able to pick up, and some of them come back and go to the bigger centers so that they could try and improve their techniques and improve the lot of women in the poorer cities. Along with this, we have the big problem of unnecessary surgery being done. Now, this may be as in the form of frequent cesarean sections, which may all not be required. Along with that, surgeries like hysterectomies being done for reasons for which medical treatment may have been of use. Now, all these are factors which, when you see in a wide display, people get opinions and take ideas home and try and develop on the ideas which may work out very useful for them in treating their own patients. And today, with the improvement of IT technology, it's easy for these doctors, even in the remote far-flung areas, with the help of telemedicine, with the help of good internet connectivity, we could see what they are doing. We could see the patient, or they could operate with our instructions and thereby try and do a procedure for which the patient otherwise would have had to travel a long distance.